morning students. This is your Mohan Rao, Zoology Senior Faculty. Today I come up with a new concept related to our reproductive health chapter. In the previous class, I initiated a new concept in this lesson, that is sexually transmitted diseases or sexually transmitted infections. And as a part of that yesterday's class, I detailedly explained the technical definition of these STDs or STIs, thereafter the causative organisms for these kind of diseases, and thereafter the modes of transmission, what are all the common initial symptoms of the diseases, and that followed by, if the initial stages are ignored, which kind of here consequences will be get developed in a victim person. Thereafter, what are all the prevention methods? Thereafter, what are all here different kind of diagnosis methods that are all available to us in order to diagnose all these varieties of diseases. In today's session, I'd like to give you the detailed information regarding various types of diseases that are all caused by the pathogens. And earlier class I explained that causative organisms includes bacteria, virus, protozoa, fungi, and even chlamydia. Such a kind of causative organisms causes various types of diseases in this humankind. So we are going to see such a kind of variety of diseases in today's session in a detailed way. Here we are with some of the diseases that are all caused by viruses. So as of now, we detailedly studied about the bacterial diseases. Now it is time to discuss more detailedly about the viral diseases. And different type of viral diseases here includes, one is genital herpes, whereas the second one is here genital warts, whereas the third one is hepatitis B, and the fourth one is AIDS. You all well know about this one. Of all these diseases, in this session, I am going to explain the three different types of viral diseases, but I am not going to focus on AIDS. Because in the 8th chapter, Human Health and Diseases, there is a detailed description regarding the AIDS. There we are going to study more detailedly about this AIDS. But in today's session, let us go with this genital herpes, genital warts, as well as hepatitis B. So let us see the first one, that is genital herpes. So this is one thing caused by the virus, and the name of the disease, it includes, as I said, it's a genital herpes, and causative organism or pathogen which causes this disease includes herpes simplex is the virus name that causes this genital herpes in us. And whereas the mode of a transmission, as you all know that definitely there will be a sexual transmission is one thing, and thereafter here not only this one, the initial days it may be get transmitted through viroids as well as genitalia. So these are all the three modes how it is get transmitted from person to person. Then how do you diagnose this, or how do you identify the person who is suffering from this herpes? It includes here important thing, clinical symptoms. Now I am going to explain the symptoms suffered by the victim whenever he is getting this whenever he get this genital herpes. The clinical symptoms that helps to us. Thereafter, antigen detection. Then what are these antigens and antibodies? These are nothing but here the proteins. So any kind of pathogen, it produces a kind of proteins. These proteins are highly specific to a concerned type of pathogen, and such a kind of proteins are known as antigens. So once the pathogen it enters, when it produces the antigens, our immunity system recognize the entry of the pathogen as well as production of the here antigen. Our immunity system it produces the proteins, and those proteins are known as here antibodies. And here the point is, antigens and antibodies are highly specific to certain kind of pathogen or a certain kind of disease. So by studying the antigens that are all released into the victim body, then we can identify the disease. Thereafter, the PCR test is available. This is a polymer chain reaction. You have to study more detailedly about this polymer chain reaction in a biotechnology. A unit is there which we are going to study in the coming sessions. So that is a polymer chain reaction. A test is here helpful to us for diagnosis of this disease. Thereafter, nucleic acid hybridization. That nucleic acid hybridization, it includes here DNA or RNA hybridization. Nucleic acids includes DNA or RNAs. Here particularly you go with these DNAs in order to here identification. So deoxyribonucleic acid, deoxyribonucleic acid. Hence they are known as nucleic acid hybridization. This technique is also available to us in order to here identification of this herpes disease. Then here what will be the symptoms? Let us see now here the symptoms of this herpes disease. This is a much dangerous here disease it is. See, these are symptoms you can see. Vesiculopostular lesions are present. Vesiculopostular lesions. That means lesion means that you know very well it is a sore or a wound. It consists of here pus. A pus containing wounds are present. They are known as vesiculopostular lesions. Is one of the symptoms of this one. And these here lesions includes here like blisters or like a pimples. They do here appear in this form on affected organ. These includes or this consists of pus within them. And second one is a cluster of painful ulcers also happen to see. The characteristic feature of this ulcer is erythromatous. Erythromatous ulcers in the sense the reddish colored ulcers are appears here. And where do these ulcers are generally appears to us? One is the genital here, external genitalia. Since this is infecting the reproductive system, on the external genitalia, reddish ulcers are here noticed. Thereafter, perianal region also, not only here around this external genitalia, perianal in the sense around the anus. Anus you know very well, it is the opening of your digestive system through which the undigested fecal matter is here sent out of your body. And around the anus also such a kind of erythematous ulcers are present. Right, and that is one important thing. Apart from that, you can see here the victim will experience the fever and he will get the headache, itching sensation at the affected parts. Thereafter, you can see the vaginal as well as here urethral discharges are taken place. So through urethra as well as vagina, here a fluid discharge will be here experienced by the victim. Thereafter, swelling of lymph nodes. Just now I said here the locations of the lymph nodes. So they are all present in the different parts, even around the genitalia. Here you can see even the armpits also. Here you can see the lymph nodes. The lymph nodes here swelling will be taking place. And thereafter you can see here urethral as well as cervix infections. Here urethral as well as cervix infections also here happens in case of this genital herpes. Right. The very interesting and important point related to the disease is there is no therapy, no treatment at all for this disease. Once in your life, if a person is get infected with this genital herpes, There is no cure at all. And throughout his life, then the disease he has to suffer from. When the immunities get rise up, then the symptoms of the disease will be get suppressed. Whenever the immunities get declined, then again the symptoms will be get reappears. So, since it is a virus, and here one point you need to know regarding the viral infections. Any viral infection, there is no cure at all, including your common cold. Now, the entire world is suffering from COVID-19. Here the virus, where there is no cure at all for this disease. Not only the COVID-19, even HIV is also there. Hepatitis B also we studied. And this is also one more thing here, genital herpes. All are viral infections. And even, as I said earlier, common cold is also a viral infection. So, no viral infections has got the cure. But only the thing that is available to us is prevention. And some of the viral infections have got the vaccinations. By taking the vaccination as a precautionary step, you can protect yourself from the viral infections. Without taking the vaccination, if you are infected with a virus, only your immunity power, it saves you. If your immunity power is high, then you can suppress here the effect of the virus. And here, this is one such a kind of disease that you need to be here noted. There is no cure at all. In the previous session, I explained 3 important diseases are there which do not have any cure at all. One that you know very well here is AIDS, which is no cure at all. But here the second one is the genital herpes, whereas the third one is hepatitis B, jaundice disease. When you get it, the traces of the virus will remain in your body forever. So these 3 are the diseases which have got no cure at all. So there is no particular therapy or a treatment for this genital herpes. Such a dangerous one it is. So we must be very conscious with regarding such a kind of reproductive tract infections. And coming to the second important viral infection in us, it includes here genital warts. Let us see about the genital warts in a detailed way. Right, this is the second type of viral infection, and the name of the disease is genital warts. Is the name of a disease, and it is caused by a virus, and the name of the virus and its scientific name is human papilloma virus. Human papilloma virus is the responsible virus for this genital warts disease. Then, what is the mode of the transmission? How it is get transmitted? You know that a sexual intercourse. So, unprotected sex naturally leads to transmission of this virus. Whereas the second one here, the symptoms. Coming to the symptoms of this one, here genital warts always develops here on skin as well as here and mucosal surface. Here it develops here genitalia as well as perianal area. It develops the symptoms on here skin, one thing, thereafter on mucosal surface. Here we can happen to see the development of a wart. Then what is meant by a wart? It is a hard outer growth on a skin with a horny surface. With a horny surface, a hard outgrowth on the skin is known as a genital warts. And these genital warts are happen to see, as I said here, one thing is a skin, and it even develops on mucosal surface of external genitalia. One thing thereafter perianal area. External genitalia as well as perianal area, in the sense I said earlier, around the anus. These warts will be get developed. One, these are all the symptoms. In case of women, it is an important thing, interesting thing. These warts may be developed within her vagina as well as the cervix also. Within the vagina and cervix also, chances of development of these warts is another symptom. Then, what is the diagnosis here? What is the method that is available to us in order to diagnose this one? Clinical symptoms. By studying all the above mentioned symptoms, you can identify this one. Thereafter, antibody here detection, type of antibodies developed within the here body here against to the pathogen or the antigen. By observing that antibodies, you can get confirmation of the disease. Thereafter, culture of the pathogens. Thereafter, DNA hybridization. The genetic material of the pathogen can be hybridized. By studying the genetic material, you can come to know here the constitutive organism so that we can confirm the type of a disease he is suffering from. Thereafter, the treatment. What is the treatment for this one? Here, this is important point that you need to here observe. Cryosurgery. In your earlier sessions, might be studied about or might be heard about cryopreservation. Cryopreservation means here preserving the gametes at a lower temperature, -degree centigrade, in a liquid nitrogen is known as a cryopreservation. But here I am introducing a new term to you, that is a cryosurgery. Then what does this cryosurgery include? And in this case, a special skills are required to a doctor, so that here you will go for surgery, a minor surgery, so that all these warts will be get removed. Then how does he perform this cryosurgery? Here by freezing these here warts with a liquid nitrogen. Freezing these warts with the help of a liquid nitrogen, these warts will be get removed. Thereafter, the another method for that, and that surgery method is known as cryosurgery. Whereas the second method here is podophyllum. Here preparations also available to us. Podophyllum preparation. Then what does it include? It is a combination of two important things. One is dried rhizome, and here the roots. Here is a point. The roots of a plant, Podophyllum pellatum. See this? Podophyllum pellatum roots combined with a dried rhizomes, and both together we can use as a preparation. We call that preparation as Podophyllum preparation. This can be used in order to remove these warts from the body of a victim. This is all about here genital warts. The second viral infection. Thereafter, and coming to here, the third type of viral infection, it includes hepatitis B. Let us see about that hepatitis B in a detailed way. This is the third important viral infection, and which is also here a sexually transmitted disease. And the name of the disease is hepatitis B. Generally, we use this technical term with a common name like a joint disease and all. And this hepatitis B is caused by a virus, and the name of the virus is hepatitis B itself. There are various groups of these viruses are there, like hepatitis A, hepatitis B, hepatitis C and all. And this is a particular disease caused by hepatitis B type of virus. And coming to here, disease get transmitted by the various methods. And the abbreviated form of this one is HBV also, HBV virus. And coming to modes of transmission, it includes here transmission of infected blood. If the infected blood is get administered into the healthy person body, and if the blood is get infected with here hepatitis B virus, 100% the virus will be get transmitted from person to person. Thereafter here, sexual contact is very common that we have been studying since the beginning of this lesson. Thereafter, the saliva of the infected person, tears of the infected person. Thereafter, misusing the intravenous drugs, abusing. Then what does it mean? Some of the drug addict persons, they do take the drugs with the help of the injections. the single injection with a needle is used by the multiple persons. In such a cases, if a person among them is get infected by this virus, and if you use such a kind of injections, and the same type of injection is used by other people in the group, then the virus will be get transmitted. Thereafter, here we the Indians have a culture of boring our ear in the nose. Here piercing is also there, making a holes to our ears and nose. We have got a culture, such a type of culture. During that time, if the needle that is using for making the holes is used for the infected person, the same one is get used for some other people also, then there is a chance of transmission of this hepatitis B virus. Thereafter, sharing of the razors. If a razor used by an infected person, the same thing is get used by some other persons without disinfecting that, then the virus will be get transmitted. And along with that, tattooing. This is a recent trend is going on in the present generation. So if you go for a tattooing on our body, the same machine or needle used for the multiple persons, if one among them is get infected with this virus, then the rest of the people also have got the chance for getting this virus, is one thing. Then what is the incubation period? So it takes here hardly 30 to 80 days span of time for manifestation of the disease or for appearance of the symptoms. Thereafter, then what here are the symptoms it includes? Here generally fatigue is experienced by the person. Fatigue in the sense, here tiredness. The person will feel the great tiredness is one thing. Thereafter, that jaundice. So this is a virus particularly affect our liver. So since the liver is getting affected, then the person will develop a jaundice also. And during that time, his skin will get turns into yellow color, and white portion of the eye also will get turns into the yellow color. Even the urine also here will come out in the yellow color. So these are all the symptoms of a jaundice. And here, along with that, here, and persistent low fever, continuous fever will be here observed in a victim. Thereafter, rashes will be developed on the abdomen, and severe abdominal pain also can be experienced. A severe abdominal pain and rashes on the abdomen, continuous fever are all the symptoms of the disease. And since, as I said in the beginning, here it particularly affects your liver, so that here it causes liver cirrhosis. Sometimes the person suffering from the hepatitis B will develop even the liver cancer also. These are all the dangerous signs. So liver cirrhosis will be get developed, as well as liver cancer also will be get developed. The person, those who are suffering from this hepatitis B. So these are all the symptoms of this viral infection. Then, what is the diagnosis method that helps to us here? And thereafter, is there any cure for that? Then let us see about that information. Now, see this, hepatitis B diagnosis method. There is a specialized blood test is available to us, and this blood test name is Australian antigen test. This Australian antigen test is particularly a blood test, and this blood test here generally used to use with this abbreviated form HPSAG. The HPSAG, it stands for hepatitis B surface antigens. That I written here, hepatitis B surface antigen test is available to us. This has got another name known as Australian antigen test. So with the help of this test, we can diagnose and can confirmation this test. Along with this, we can happen to see the ELISA test also. enzyme linked immunosorbent assay. There is one more here test is available. With these two tests we can diagnose and confirm the hepatitis B. Then what is the treatment for that? Here is a point to be noted again. This hepatitis B is also incurable STD. There is no cure at all for this sexually transmitted disease. But here the fortunate point related to this one is vaccinations are available. The vaccines are developed with the help of recombinant DNA technology. So about this recombinant DNA technology also we will study more detailedly in a biotechnology chapter. So recombinant DNA technology developed the vaccinations here for this hepatitis B. It is a precautionary step, but the point here is there is no cure for this disease. Only the prevention method is available. The prevention is nothing but taking the vaccinations related to this one. So these are all the three varieties of viral diseases. Whereas the fourth important type of viral disease also there, nothing but here, HIV/AIDS. We will study about that particular disease in forthcoming chapter, that is human health and disease, in a detailed way. Right. Coming